All right, anyone who has ever been diagnosed with a neurological condition knows there's no blanket treatment for what ails them, right? There's a lot of trial and error. What works for one person might not be the best for the next. It is solving these dilemmas, though, that drives my guest today. So I'm happy to welcome Dr. Joe Coppus, founder of Delta Neuro Health, in this sponsored segment. Good to meet you, Doctor.
Good to meet you too. Thanks for having me back.
Absolutely. So let's first describe, because you like to say that your purpose, right, is to care for each patient on an individual level. We are trying to make them happier and healthier, two great things we all strive to do. So tell me a little bit more about, your office and what it is that you aim to do.
Yeah, so at Delta Neuro Health, we do three main things: functional neurology, functional medicine, and neurofeedback care. Today I want to focus more so on the functional neurology aspect of things. And where that all begins is with a thorough evaluation. We want to find out exactly what's going wrong with somebody neurologically.
Yeah.
And then from there we can come up with a customized, non-invasive treatment plan to actually help their problems.
Did you see that there was a need, a demand for this in Columbus? Because there aren't a lot of people that really focus on what you're talking about today.
Yeah, that's a good question. And we did. And that's one of the big reasons why we decided to come to Columbus. I've had experience working in Miami, Florida, Atlanta, Georgia, Chicago, Illinois, but I'm from Ohio originally, and I really wanted to bring the skills and training that I've acquired over the years to my home state to fill that need.
All right, Dr. Coppus, we're going to talk about some of the conditions that you're able to treat. And there is a reason. There's a half-empty water bottle here, I promise you. But we're going to talk about that first, because these are things that people may be struggling with and not realize that there is help, right?
Right. Some of the main things that we see in our office, things that tend to fall through the cracks, things like post-concussion syndrome, migraine, dizziness and vertigo. But a big one has been POTS, or postural orthostatic tachycardia syndrome. And that's why I brought the water bottle.
Okay, so then let's talk about that, because we said earlier, I was just chatting with you, a lot of people don't really realize or recognize what symptoms somebody has when they have POTS, right?
Right. And what POTS is, essentially, it's an issue where the patient might have a really hard time delivering blood to where it needs to go, most importantly, the brain.
Okay.
Right? So there are specific reflexes that should be intact in order to get blood up into our head so that we can think clearly, we don't get dizzy and lightheaded. But what happens with somebody with POTS, say they're laying on their back, the water represents blood. Blood is equally in the feet or the base of the bottle as it is the cap. But then when we have somebody stand up, we can see that gravity actually pushes that water down, right? Just like in the human body.
Yeah.
So we need these reflexes and these mechanisms to actually increase blood pressure, to get blood up, back up into the cap or the head. And if that doesn't happen, then our brains are deprived of oxygen, of blood, and we might get lightheaded, we might be brain foggy, our memory might start to suffer, things of that nature. So what we would aim to do is try to rehabilitate these mechanisms, these neurologic mechanisms, so that blood is getting back up into the brain adequately again.
And it's interesting that you're able, first of all, to do that, to retrain kind of the body and how it functions. But how is it then? Is it, through a series of exercises? What is kind of the process somebody could expect?
Yeah, so everything we do is non-invasive, and it's aimed to be therapeutic in nature, so we want to actually solve the problem, right? So some things we might do would be like tilt table therapy, different electric stim, eye movement exercises, vestibular exercises, a number of, like I said, non-invasive therapeutic interventions to rehab the brain. And you may have heard of neuroplasticity.
Yeah.
So that's the concept that the brain has the ability to adapt and change so long as we give it the appropriate stimulation and environment. And that's exactly what we're trying to do.
Okay, so yeah, retrain the brain. We hear that. That's actually incredible that it does that. And then I want to talk too about each case being so individualized, because that's another aspect I think that's important. As somebody who may know somebody else who's struggling with the same thing, the treatments might not be the same, right?
Absolutely. And that's why we need to take such a thorough evaluation. Our evaluation is 3 hours long.
Okay.
Because the brain is the most complex system that we know of, right?
Exactly.
So we have to be thorough in our evaluation. And no brain injury is the same, no patient is ever the same, which means our approach has to be tailor-made to that individual.
And Dr. Coppus, you are not overly reliant, and you don't want your patients to be overly reliant on medication. I feel like we are in this world where that is often the first and maybe the most, right, prescribed treatment for a lot of symptoms. So is it that you are then teaching them, right, other things they can do that give them that same result or even better?
That's right.
Okay.
Yep, we do not want to be reliant, that's our philosophy anyway, reliant on medication. Most of the patients that come to see us also do not want to be reliant on medication. So that's what we provide. We provide an alternate to pharmaceuticals.
To pharmaceuticals. All right. There is a way you can get started too. Just have a free phone consult if you want to start before you come in for that initial consult, right?
That's right. Yep. You can reach out to us via our website or giving us a call and get a free phone consult scheduled with me or one of our other providers. And we'd love to chat and see if you'd be a good fit for us.
All right, perfect. Again, it is Delta Neuro Health, so the website the same, phone number and all that info up on screen for you. Dr. Coppus, thank you.
Thank you.